Hello, I'm Dr. Wendy Bridges. How does Medicare actually work, and how do you know how much money you're going to get back when you pay for your doctor's surgery consultation? Okay, so Medicare is quite complicated. It'll take me a while to explain it all, but to put it simply, the Medicare rebate is the amount of money that the Australian government has decided to give back to people for certain sorts of health services that they receive in our community. So it's the rebate that the government's decided to provide. It's not the amount of money that a doctor can charge for the service. The doctor can set their price to whatever they want. The rebate is the amount of money that the government's decided to give back to the patient when they receive that service. Doctors can bulk bill, and what this means is they've decided to charge the amount that Medicare is actually going to give back to the patient, the same amount. Or they can private bill, which means they can set their price and you'll get part of the money back from Medicare. Most of the time, to get a Medicare rebate, the patient actually has to see the doctor. Your doctor can provide you services and charge you for it without you actually seeing them, such as getting a script that's been requested by email or on the phone, but you can't get any money back from Medicare for the doctor doing that. There are special item numbers, such as care plan item numbers or mental health item numbers. These are attendance items also. The doctor actually has to see the patient, then go through a process. Medicare requires that there are certain components, information collecting, that the consultation should last a certain amount of time. Then the doctor can put a special item number through to Medicare that unlocks some extra visits, some extra rebates when you go to see the psychologist or the allied health professional. So when your doctor asks you to come in to do your care plan or come in to do your mental health care plan, and it'll need to be a certain amount of time, and they ask you certain questions and need you to do certain things, they're not trying to be painful. They're not able to just do you a mental health care plan or a care plan for your chronic illness just because they know all about you and saw you last week, without you coming in and spending the time and doing those activities that Medicare decrees. That's actually a rule. They have to do that to provide that service to you. Doctors and patients need to communicate a lot more about the cost of healthcare. If you want to know what's going on, just ask. Your medical receptionist or your practice manager should be able to help you, but do communicate with your doctor. Your doctor will help you both to be able to get organised and organise your healthcare to make the best use of the Medicare system. I'm Dr. Wendy Bridges. If you need health information from a reliable source, I'm a GP. Subscribe to my channel.